Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday at East Cooper Medical Center. Today, we're visiting a low-country bariatric surgeon to talk about a minimally invasive procedure to help patients who regain weight after gastric bypass surgery.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Washington. He's a bariatric surgeon here at East Cooper Bariatric Surgery. Thanks for having us today.
Thank you.
All right, I'm ready to learn some stuff because I find that every time I'm with you, I learn a ton. Today, we're actually talking about TOR,
Right.
a TOR procedure.
TOR procedure.
Okay, so what is it?
Well, it stands for transoral reduction endoscopic. But basically what it is, you know, a lot of people have had gastric bypass surgery over the years. Believe it or not, the first gastric bypass was done in 1962. So there are many patients that have it. Over time though, the body accommodates, and the pouch, the little pouch we create, and the little connection to the intestine that we create stretches. And anything will stretch in the body over time. And those patients though, when it does stretch, feel as if their bypass doesn't help them get full as fast as it used to. They felt like when they first had it, they ate very small, maybe 2 golf ball sized meals, and they were full and they stopped eating. And now they feel like they can eat more because the pouch stretched or the connection to the intestine stretched. In the past, you know, to fix that, we'd have to go and reoperate. And some of those operations were the most high-risk weight loss surgery operations because you had to redo an operation you already did, and there's scar tissue in the area. So when you looked at, we call those revisional surgeries, those are the ones that, you know, carried the highest risk. So now with a new device that goes on the end of an endoscope where we can actually place sutures, you know, by introducing the endoscope through the mouth, we're actually able to go down and make the pouch smaller and make the anastomosis smaller, all without surgery.
Okay, so my question is, you know, sometimes, and I'm not saying this is the situation, but this could happen since over time the stomach expands and all of that. This isn't necessarily because people who've had gastric bypass haven't been following their diet, right?
Right. I don't believe that patients stretch their pouch. I think that the body just accommodates over time. You know, basically I make the analogy that if I put an earring on your ear and I added 1 gram every day, by the end of the year I could get your earlobe to stretch down to your shoulder. Okay? So over time, it's just the natural body's response to a stretch over time. But now we have a outpatient, easy, safe procedure to make those pouches and the anastomosis, that connection, smaller, where before it was a very, you know, risky operation.
Okay, so compared to the initial bariatric surgery, what's like the recovery, like the moment?
Well, patients go home the same day. We usually have them on liquids for like a week, and then slowly advance them to soft and solid food. But the thing they will tell you right away is they feel like their bypass is back. They feel as if they just had their bypass again.
So they're going to see that significant weight loss again?
So we'll see that significant weight loss again. The thing is, we try to get them before they gain all the weight back. We try to get them on the incline when they start gaining the weight back before they've returned to their original preoperative weight. It works better if we can intervene early in these patients.
So they're not getting like diabetes and things like that prior to it. Okay, so overall, who would you recommend this for? I mean, obviously the patients.
I recommend it for any patient that's had a gastric bypass that is regaining the weight. And I'm not saying we're going to do all of them. Most of the time what we do is we bring those patients into the office. We have them meet with myself, my dietitian, and then we decide whether or not it's just dietary. Can we get them going back in the right weight loss direction with just diet, you know, with just, you know, working with them with our dietitian, or is it really that their pouch is stretched, and we'll work them up for that.
And for the folks that don't know about East Cooper Bariatric Surgery, just talk about like your team and the fact that you're there from start to finish.
Right, so we have a comprehensive bariatric program here at East Cooper. We have a registered dietitian. We have our practice manager. We have the nurses.
You have Dr. Washington here.
We have me here. We have our hospital coordinator. So we have an entire, you know, comprehensive bariatric team dedicated to weight loss surgery.
Because the moment you get bariatric surgery or anything like that, it doesn't end there, right?
No, you're outpatient forever. Forever.
Forever.
Because it's been shown that the more you follow up, you attend our support groups, and the more you stay involved with the practice, the better your long-term weight loss results.
Gotcha. All right, well, thank you so much, Dr. Washington. And for more information, head online to eastcoopermedctr.com.